One of the structures that we're going to find also in the face is the parotid gland, which is the largest of the major salivary glands. It is located anterior and inferior to the external acoustic meatus, in deep hollow between the ramus of the mandible and the sternocleidomastoid muscle. Partly overlaps the masseter and the sternocleidomastoid muscles and is surrounded by the parotid fascia. Now, the parotid duct, which is that structure over there, originates from the anterior part of the gland, and it passes anteriorly and superficial to the masseter and inferior to the zygomatic arch. At the anterior border of the masseter, it turns medially and pierces the buccal fat and the buccinator, and then it opens into the vestibule of the oral cavity. The structures within the parotid gland from the superficial to deep are going to be the facial nerve, the retromandibular vein, and the external carotid artery. And some of the anatomical relations to the parotid gland includes superficially the skin, the superficial fascia, branches of the great auricular nerve. Posteriorly, it includes the mastoid process, the sternocleidomastoid, posterior belly of the digastric, and the styloid process with attached muscles. Anteriorly, it includes the ramus of the mandible, the masseter, and the medial pterygoid muscle, and deep is going to be the pharynx. Next, it's the scalp, which is part of the head that extends from the superciliary arches anteriorly to the external occipital protuberance and the superior nuchal lines posteriorly. On each side, it extends inferiorly to the zygomatic arch. The layers are referred to as the scalp proper, and it is the tissue that is torn away in scalping injuries. So the first layer we're going to have here, I have written down an acronym here of the word scalp. First one is going to be your skin, which is a thick layer that has hair, and it bears with numerous sebaceous glands. The next layer is going to be the connective tissue, which is a dense connective tissue that contains arteries, veins, and nerves that supply the scalp. And when the scalp is cut, this dense connective tissue tends to hold these blood vessels open, which results in profuse bleeding. Then we got the aponeurosis, which is also known as the epicranial aponeurosis, which connects the frontal and occipital bellies of the occipitofrontalis or epicranius muscle. Then we got the loose connective tissue, which allows the movement of the three superficial layers over the skull and is referred to as a danger area of the scalp because infections can easily spread in this layer. And lastly, we got the pericranium, which is the periosteum covering outer surface of the bones of the calvaria before finding the actual bone tissue. The scalp is going to be innervated by a couple of nerves, as you can observe right here. So these are going to be anterior to the ears, and it is supplied by branches of the trigeminal nerve, or they can be posterior to the ears, and it's going to be supplied by branches of the upper cervical spinal nerves. So some of the nerves include the supratrochlear nerve from V1, supraorbital nerve also from V1, the zygomaticotemporal nerve from V2, the auriculotemporal nerve from V3, the lesser occipital nerve from the ventral ramus of C2, and the greater occipital nerve from the dorsal ramus of C2. There's also an arterial supply to the scalp, and these main arteries lie in a dense connective tissue deep to the skin and freely anastomose with each other. Obviously, these arteries are going to be also accompanied by the corresponding veins that are also anastomosing with each other. So the arteries include the supratrochlear artery from the ophthalmic artery, the supraorbital artery that comes from the ophthalmic artery also, and the zygomaticotemporal artery, also coming from ophthalmic artery. Then we got the superficial temporal artery and the posterior auricular artery, as well as the occipital artery, and these are coming from the external carotid artery.